Wayne Walker.
Wayne Walker.
Wayne Walker.
Wayne Walker.
This is complete package in my eyes. Like it's got great shape, it's got great condition.
He is the next big thing in bodybuilding. Mark my words.
Just one.
And actually, you can, and they'll show you in therapy. You can't put a little bit of weight down. That's okay.
Just a little bit, yeah.
Yeah, just a little bit.
I'm tempted
It
to
may
not
not
do
feel,
that.
may not feel great right now, but it's actually a good thing.
Okay.
And so basically, what we have, these pictures are what we took inside her knee, so you get to see what everything looks like.
Yeah.
And to me, in a polite way, for as much weight as you move and you push around, your knee actually is very healthy, other than that torn ACL, meniscus. But in terms of cartilage wear and things like that, you really don't have much of it, which is wonderful for you.
Okay.
So these pictures, which would be yours, you can do what you wish with it, but underneath the kneecap are the patella, nice and smooth, no cartilage wear. Where the kneecap rubs, called the trochlea, nice and smooth, no cartilage wear. Right here, we should see a nice solid rope for your ACL, the ligament in your knee. We don't see anything, just some flimsy scar tissue, so we can tell that it's completely torn. On the inside part of the knee, however, we see this sort of wavy tissue, that little ribbon there. That's that meniscus that's torn. After we clean it up, we would leave a nice smooth rim of it. On the outside part of the knee, ends of the bone look good, the outside meniscus looks nice. This picture just shows placement of the graft. That whitish tissue with a little purple marker is a tissue acting as your new ACL, the new rope within your knee. And then your leg all the way straight, showing it doesn't get pinched or caught.
Okay.
So everything went very smoothly, everything went A+.
Yeah.
So as I like to say, in a nice way, you own this now,
Yeah.
but what you get out of it is what you put in therapy. Obviously, you're a conscientious person with your body and working out, but doing things the right way, good stuff happens.
Okay, so. Sorry, could you pass that on me, please? When I posted the first video that you and I did, one of my clients reached out to me and said you recently worked on our son.
Oh, okay.
His name is Wayne Peart.
Yeah, 100%.
Yeah, I train him and his mom at the gym.
Yeah, wonderful. They're great people. I know
Yeah.
the fathers also.
Yeah.
So good people.
Yeah, she said he did his shoulder operation.
Shoulder,
Yeah.
torn labrum.
Big guy, big kid.
Oh, big kid. Well, the dad's big.
I never seen the dog before.
Oh, dad's a big boy too.
Yeah, most definitely. I expect that.
Yes. So these two things are what you're going to give the physical therapist. Okay?
Those two things, yeah.
This is going to tell them what to do. The
Yeah.
instruction, what we'll call a protocol sheet.
Okay, sir.
Now, the one thing is,
Go ahead.
by next week, we want you in physical therapy to be able to bend that knee 90
By next
degrees.
week. Okay.
So it seems like a lot, but you'll probably get there pretty easily.
Yeah.
But it's something that we go at a certain pace.
Yeah.
In some fields, bigger, stronger, faster is better. In this case, we do have to respect the biology inside. So sometimes you may feel you can race ahead. We want you to go at a certain tempo.
Yeah.
If that makes sense.
Yes, sir. I understand what you're saying fully.
So you'll see my staff next week. And if
Yeah.
it looks good next week, we'll let you get it wet in the shower. So it has to stay dry until then.
Yes, sir.
Keep taking ibuprofen, pain medicine only as you need to. And we'll go
So keep taking the ibuprofen
for a few days through
and
the
the
week.
pain medicine when I feel like I need it.
Correct.
Okay.
Any questions that you might have?
No, that would be all. I don't have any questions right now.
Dwayne, as I like to say, make me proud. You'll do
Yes,
great.
sir. Yes,
Have
sir.
a wonderful day.
Thank you, sir.
Okay.
And Stephanie's taking care of my bandages. Thank you, Stephanie.
You're welcome. Put your brace back on.
Yeah.
Underneath. Okay, it feels okay.
It feels okay so
Very
far.
good.
It should be a bit firm though, right?
Right,
It should
exactly.
be. Okay.
Not too tight, but just enough to keep it up over your leg.
Yeah.
And you can tighten and loosen these throughout the day too.
Yeah.
Let me cut this one for you. I'll be right back.
All right. So you heard it from the doctor's mouth. It was a good surgery. It was successful. All went well. So I'm supposed to just stay on my meds and focus on doing physiotherapy. That's pretty much it right now, guys.
Just a little bit more. All right, how's that feel? Okay.
Yeah, it feels okay.
I didn't bring up your sock actually.
Oh, that's fine. That's fine.
Yeah, we gotta bring that up a little bit.
Oh, you mean the other side? Oh,
Yeah, this one here.
I thought you were referring to mine because I'm
No.
like, nah, mine is fine.
I always do that.
And this is for like for circulation and
Exactly.
preventing
Compression.
clot and all of that.
Exactly.
A sock can do all that.
You got it. Hold everything in. And that's it.
Yes, ma'am.
Does that feel okay?
Yes, it does.
Perfect.
All right, so where we off to next?
We're gonna go check out and get your next appointment.
All right.
Oh yeah, stopping by.
Then let's say pain levels 0 to 10 at its higher range over the past 24 hours since surgery. What would you rate
Yeah, 5 to 6.
it? Okay, it's not too bad.
Yeah, it's that I'm not feeling pain really. I'm just feeling like the pressure in the knee.
Yeah.
You know that pressure built up. Yeah. So
Now,
not pain
past
really.
medical history, orthopedic, ankles, knees, elbows, shoulders, back. Any other major injuries or surgery?
I've never been injured before. I've never done any surgery before.
I don't think any other kind of lingering health conditions, things, serious things, heart condition, cancer, diabetes.
Just no, I'm just asthmatic. That's it.
Now, obviously, we want to continue lifting.
Most definitely.
So what people about is this first week,
Yeah.
you can't really shower good here, so it's hard to clean this site, right?
Yeah.
So the one thing that I'm going to tell you to do is to try to be a little easier. If you want to get in and do upper body stuff, you can,
Yeah.
right? But I really want you to try to not sweat too much.
Yeah.
So I want you to keep it lighter for the week until
Yeah.
next Wednesday or Thursday when you have your follow-up,
Yeah.
and then
Yeah.
they'll do all the dressings. Then you'll be able to get it wet and shower.
Okay,
No
so
problem, right?
after next week Wednesday,
Yeah.
then I'll be able to like get it
You
just
can
that.
still do a little stuff. It all has to be seated.
Yeah.
If it's anything free weight, you need somebody to grab the weights for you.
Yeah, I won't be
Right?
training though.
Yeah.
That's out of the question. I won't be training or doing anything like that.
Yeah. But if it's just upper body machines, you can
Yeah.
get as long as you can get in there comfortably, you can get
Yeah.
to do it. And we'll talk a lot especially after next week, about staying in the gym and doing everything you can.
Yeah.
And also training this leg still.
Yeah.
Right?
Exactly.
We still want to train this leg. Obviously, you want to keep the size on this leg.
Yeah.
But this other part of it too is the better you train this leg, the faster this one's going to come back. There's
But-
even research that shows if you just keep training
this
this
leg.
one, like if you say you didn't have an injury, you only trained one leg.
Yeah.
That one would probably actually still have this little bit
I
of training
saw that in
adaptation
research
to
too.
it, right?
Yeah, I saw that in research as well.
So
I did some
we want
research
to
on
keep the rest of
that.
your body going as much as possible. So we'll talk
Yeah.
about that week to week.
Yeah.
And then you'll just give us a lot of feedback on like, I really want to train this type of exercise.
Yeah.
How should I set this up?
Yeah.
You know, to work with it. I want to work hip extension, and we'll figure
Yeah.
out a way for you to do it, stuff like that. You know.
Yeah.
So we'll talk a lot about that stuff. Outside of that, what we're gonna do is just start with a few exercises right off the bat here.
Yeah.
We're gonna start exercises in the brace first. And then we're
Okay.
gonna pop it off and do a couple things outside of the brace.
Okay,
I'll have a whole
alright.
plan written out for you, all
Yeah.
type of stuff, all right?
All right, but let me just dial back a little bit. You said after next week Wednesday, when you do the next dressing and cleaning, After that, then is when it's be okay to shower this side and
Yeah.
so forth. Okay.
So you'll be able to pop the brace off, go in the shower. Just got to be real careful.
Yeah.
All depends on your shower setup. If you
Yeah.
have a big enough shower to have a chair in it,
Yeah.
obviously that's a nice advantage.
Yeah.
So you can just have the leg out straight there.
Yeah, yeah.
But it takes a little bit of kind of trial and error. You got to figure things out a little bit.
True story.
I can give you lots of advice, but you're going to figure things out on your own.
True story.
There, you know what
Yeah.
I mean? So you can still shower without it. A lot of people will do a trash bag, or they
Yeah.
just leave the leg kind of out of the shower.
Yeah,
If you
and
have like,
a
kind
mop,
of a
you wanna
handheld
come up,
shower,
yeah.
do like that.
Yeah.
So you'll figure those things out. But from there, we're going to start pumping this leg right away today. Hopefully, we are leg pressing, maybe even squatting next week.
Yeah.
Doing body weight stuff. You'll definitely be walking on the treadmill. We're going to get you on a bike as fast as possible.
Yeah.
So we're going to move fast with it as long as everything is reacting well.
All right.
Sound good?
I'm on board, my brother. I'm with you.
So the first exercise we're actually going to lay you flat for.
Yeah.
So lean forward here a little bit. Come right here. Hey, Davis. Get your pillow here. Go all the way back. So first thing we're going to work on is a straight leg raise. Let's bend this knee. You're going to do your best to try to tighten your quad up and lock your leg straight. You're going to feel
Yeah.
like you can't get a good contraction there,
Yeah.
right? But do your best to do it.
Yeah.
So take toes straight up.
Yeah.
Try to lock this straight, and we're going to try to raise this leg to the height of this knee. All right? So you're going to use your abs a little bit too. I'm going to be right here with you, helping you, all right? There you go. You got it.
Yeah.
How is that? Not painful?
Not painful.
Awesome.
But I do feel the pressure, you know?
Yeah. Let's see if we can get 3 sets of 10 of these, okay?
All right.
We'll let you got it all on your own now. There you go. Quad's doing a little something. Beautiful. You just rest 30 seconds after the first 10, all right?
All right.
Good. Let's start making your packet here. How do we do without the sleep, my man? You wore it at work, man?
This hurts. Best believe. So rest for 30 seconds. That's what we're doing now. So you're seeing it firsthand as it's happening. Today is Friday, the day after my surgery. And we're doing physio already. I guess that's a good thing, right? So a more speedy recovery. Yep. Okay, so I'm gonna do my second set now. Second set of 10. It hurts. God damn it.
Yeah, we gave them a long list for that.
I can't fake this, yo. Believe me, I'm not faking this. I'm feeling all the pressure, all the tension, all the build up in the knee, which is expected after surgery, right? I'm not in any pain though. There's no pain at all. And I didn't even take any medication this morning for pain, so there's no pain at all. But just the pressure in the knee. You get me, that's all.
We're going to go onto your left side, and we're going to try to get the glute medius a little bit, all right?
Okay.
So roll over onto the left there. Good. Now remember, when we're working glute medius, it needs to be not only lateral, but a little bit back too, right? So if the leg's too far in front,
Yeah.
over here, and we go straight up, it's going to be all TFL right there, right?
Okay.
So if they come back and lead with that heel,
So it can be loose. Okay.
yeah, make sure we're feeling it in the glutes
Loose.
more than the front of the thigh. But you're
Okay.
still trying to lock that quad
Okay.
if you can, all right?
All right.
Let's try 3 sets of 10 of that one.
Okay.
That one should be slightly easier, actually, because you get to use your glutes a little bit.
Yeah.
But don't forget to focus on this.
That's fine right there?
Yep. See that toe, how it wants to start rotating up?
Yeah.
Try to resist that a little bit.
So keep it straight.
Yeah, think straight forward, because we want to keep it glute medius. Any bit that you rotate, you're going to start to get into the rotators of the hip.
Okay.
We're really trying to isolate here. Perfect. Now you got it. 3 sets of 10 of that one, and then we're going flat on your back
Yeah.
again, all right? That's perfect. Think slightly behind the
Yeah.
body. Good. Louisiana, that's it.
Fuck. Is this how my clients feel when I train them in the gym? Yo, this is kicking my ass right now. Kicking my ass right now, yo. I feel so tired. Shit. But we're getting it still. We're getting it.
There's a lot of people associated with that new spot that he's doing it. Where there wasn't a here, and I don't think there's any.
That's fine?
Yep, that's perfect.
Shit. That's the second set.
Feeling in the right spot.
Shit. Fucking me up. Fucking me.
The stimulation on the quad,
Yeah.
especially that VMO head.
Yeah.
And you're gonna work on good isometrics with it, all right?
Okay.
It's gonna break it down for you.
All right. What's up, Ian?
How's it going?
I'm doing good, my brother.
Good, let's just get this all the way up here. We can bring it right. So with this,
Yeah.
I'm not sure if you've ever used this before.
Yeah, I've used it before.
Yeah, so you understand the concept behind it.
Yes, sir.
So what I want you to do here, while the machine is on, it's gonna go on for 10 seconds and then off for 10 seconds.
Yeah.
While it's on, I want you to squeeze both of your thighs.
Yeah.
Right? Just because this one helps set a good example for that one to help
Yeah.
the brain recruit a little bit better.
Yeah.
So I want it to be strong but still tolerable. I don't want
Yeah.
it to be painful or anything like that. So you let me know when to stop.
All right.
Right after this, or
Yeah, it's on.
actually, you can actually tell this where the shoulder started off.
That's fine.
You right there?
Yeah.
But it's been progressing.
And you say keep flexing the quads each time?
Yeah, well, just constantly holding it down for
Oh,
the 10 seconds.
oh, hold it flex.
Yeah,
It's been doing really good.
good. Think about squeezing the back of your knee down. Okay, right here, good.
Do you need dumbbells?
And when the 10 seconds is up, relax.
Yeah, then you're not doing anything.
Okay, all right. That's what's up, peeps. You're seeing it as it happens. You're seeing it as it happens. Electrostimulation. You're seeing it as it happens firsthand. So, as promised, I'm trying to bring you guys on this journey with me. So, you can be there the whole time, see exactly what I'm going through as I go through this surgery, the recovery, my whole mindset, you know, the do's and don'ts, all of that. So you're going to be here first and with me, and we're going through it together. All right?
Just because it'd be more so, even so aggravating, I think it's going to take away from you focusing on good movement and stuff. I would separate it. It's hard to say. Everybody's different. So when people want to get back to running after it's really aggravated.
So today's day one of physiotherapy, so it's nothing too crazy, nothing too strenuous. Just some simple stuff right now because I'm fresh out of surgery, so it's just some basic stuff. But we're looking forward to everything that comes with this.
We help the brain recruit
Yeah.
the muscles again.
All right.
Yes, you should be able to get a little bit of contraction right after that. And what we're really looking for is getting that VMO really contracting hard again. So just try to visualize it as much as possible. Stare
Right.
at this when we do it. Sometimes even touch it, right?
Yeah.
A little bit, and just
Yeah.
try to wake it up a little bit while you're squeezing there.
Yes,
All
sir.
good things to do. Beautiful. 30 of those. And have you ever done any blood flow restriction training on your own?
No.
With like the cuffs at all?
No, but I have them though.
Yeah.
I know of it.
Yeah, we definitely. I'm hoping our cuff fits your leg. It should. If not, we'll get one that does, because that'll be a really big advantage. Because what that allows us to do is get more damage to the muscle without having to increase the weight as much.
Okay.
Because what happens sometimes is like you're like, it's not that the weight's too heavy, it just bugs my knee a little bit.
Yeah, I get you.
So it'll allow us to do like good high volume work.
Okay.
So that'll be a big part of the rehab for sure.
Okay. All right.
And then the good news is, as far as bodybuilding goes, because it doesn't involve a lot of any cut or pivot, is you're going to be able to have to not worry about that progression as much. You know? You still want to go through a full rehab and make sure we work on everything to have the best possible knee, but it's not really a part of your routine. You know what I mean? There's nothing that you need to worry
change direction
about.
and change the speed and stuff like that.
Exactly. Your thing is all about mechanical tension. You know?
Yeah.
Right after those, we just got a couple stretches that we got to go over, and then we'll talk a lot of strategy for the weekend.
All right. Yep. You heard it, and you're seeing it. You're seeing it for yourself. Look at that. Flexing both legs, and you can see that this one still has more development than this one. Look at that. See the size in that versus the size right here. It's gone already. That's what's up. So, barely no muscle. Barely can contract. But part of the journey, guys. It's a part of the journey. So you're seeing it right here. Raw, uncensored, seeing everything.
Forward and back goes, there is no chance that you're going to tear that anchor out. Not going to happen, right? And if it did happen, it's a surgical failure, but never happens with Dr. Yoldis, all right?
All right.
But you don't want to force it at all. So what we're going to do is we're going to slide this off. Slide off pretty easy. There we go. Scoop back on the table as much as possible. What you're going to do is we're going to have you use both of your hands to help pull it and bend it. You're going to use your hamstring a little bit, right? What it's going to be is you're just going to slide it along the table, in and out like that, right?
Okay.
So what we're going to say is, let's say your base level of pain is a 5, right? 5, 6, maybe even 7 is okay. 8, 9, 10, you're cranking on it a little hard at that moment, right?
Okay.
Every rep, every set, every day, try to go a little further. No different than progressively overloading a squat, right?
All right.
Let it come to you a little bit. Don't force it, all right?
All right.
So we're going to go around the foot with this guy right here.
Yeah.
You're going to grab this with both hands. You want
Okay.
the video? I'll take it if you want. You want me to film you doing it?
Okay.
Right? And then what we're going to do is start to use that hamstring a little bit, but really help. Start to just bend and keep the heel on the table. Take that for right now. Back out.
Okay.
And then every rep a little bit further if it feels okay.
Yeah.
The goal for the first week is to get it to 90 degrees. If you get faster than that, then we're loving it. If you come back on Monday and you're like, look, I can get 100, you're definitely allowed to take it. I just don't want you to force it. All right? That's perfect. Anything 45 degrees and over first day is really good, actually, especially only being 24 hours out. Beautiful.
Definitely feel it in my hamstrings and.
Yep, you're gonna feel it a little bit. You're gonna feel it a little bit. Like I said, just don't torture it.
Yeah.
We're gonna get about 30, and I'm gonna get a measure. General, just advice. You want to try to elevate it to help with the swelling drain out, right? So every time you're laying flat, trying to get it up above the level of your chest.
Up above the level of my chest.
I
Okay.
put 5 to 10 times a day, anywhere from 10 to 30 minutes. You can do more than that.
Yeah.
Ice. The only thing I don't like about ice is icing for too long. Because while ice is great for pain and swelling, it slows down circulation through the area a little bit, right?
Look at
we
that.
need both. You know what I mean? We
Yeah.
need to get that pain and swelling down, but we also need lots of circulation. So I like to keep it just to 20-minute sessions. You can do 20 on, 20 off as much as you want. I put 8 to 10 times a day. As soon as you're done with the ice or while you're icing, start pumping that ankle up and down. and start doing quad sets.
Okay.
Get that lymphatic pump started again, right?
Yeah,
Because that
yeah.
lymphatic system needs muscle activation in order to really work, right?
Okay.
Now the heel propping. This has to be out of your brace, right? And all I wrote for this was per tolerance because everybody's a little different. It shows it on the quad
That's
set
the last. That's the last
exercise,
one we just did just now.
where I'm going to put something under the heel
Okay.
where I showed you, right?
Yeah.
You can even do your quad sets like that too. I don't do it first day because usually it's a little rough,
Yeah.
especially if you're only 24 hours out. But yeah, just finding something to prop the heel up a little bit.
Yeah.
So roll the towel. You got a yoga mat or anything like that.
Yeah. So that's something to prop the heel up.
Yep. Or if it's like an ottoman situation, just push the ottoman away a little bit more so it's got more space to hang straight.
Okay. Oh, I feel you. I feel you.
Yeah.
Okay. Okay.
And then so
Yeah.
that's going to really help us get a head start on getting that. Now, everybody's different. If you're having a lot of hamstring pain,
Yeah.
you might only be able to tolerate that for a minute or so.
Yeah.
So if that's the case, do it more often throughout the day.
Yeah.
If you can sit like that for like 10, 15 minutes, then you probably will need to do like maybe 2, 3,
Yeah.
4 sets a day.
Yeah.
But it's going to be right here. Just getting that so it can hang a little straighter.
I feel
there.
it. Yeah.
that,
Yeah. I
right?
get what you're saying.
You want to make sure you're
Yeah.
spending some time like that each day. And what happens is the brace actually prevents you from getting that much extension. It keeps it
Yeah.
ever so slightly bent.
Yeah.
So you got to do this outside of the
Brace. Okay.
Any other time besides doing your heel slides or this,
Yeah.
you're in the brace.
Yeah.
Sleeping all other time, right?
Okay.
But when you're doing this, make sure you're just going to be sitting for a while, not doing anything else, right?
All right.
And then you can spend some time like that.
Okay.
Outside of that, that is the routine for the weekend, my man.
All right. All right.
So let's have you breathe.